Hey guys, what's going on? Welcome again to my YouTube channel, Eric Broadus YouTube. I say welcome again to my YouTube channel, Eric Broadus YouTube. And in this video, I will be covering some more military content. And this right here should be the last of it for the commissioning officer program in the United States Coast Guard. And for this segment and for the next couple of videos, there's several more I guess you can say rates, or pathways and career fields in the Coast Guard that you can serve in as a commissioned officer. And this one is basically going to cover the health and let's see, it's going to cover the health profession program. So these next couple of videos, it's about 5 or 6 more that's going to cover these commission programs in the health and professional rates. So for this one, we're going to cover clinical and rehabilitation therapists. So for those of you that are considering serving in the Coast Guard as a commissioned officer, or those that may even already be in it, you just want to transition, covering the health professions. But anyway, for this one, we'll cover the clinical and rehabilitation therapists. So let's roll with it, guys. Let's go with it. Okay, so obviously serving as an officer in the Coast Guard in the United States Public Health Services Commission Corps, it is detailed, saying to the Coast Guard, and it specializes in physical therapy. And obviously you will be treating military members and probably some civilians, but obviously it's going to be mostly Coast Guardsmen, because that's what you're going to be exposed to. But if you have a joint command, it'll be military members. But anyway, a patient is a patient. So let's talk about this. Okay, as a commissioned officer, okay, in the clinical and rehabilitation therapist, right? That's what you would be in this particular rate. Okay, you obviously be assigned to medical facilities and in the Coast Guard, or if you're serving in a joint command, you may be working at a hospital or a clinic, that's designated, by the United States Armed Forces, and I guess in certain specialized cases, you may even, serve outside of military installations. But anyway, basically, as a clinical and rehabilitation therapist, you'll treat your patients. The majority will be military. And also, this particular career field, as an officer, it'll give you the opportunities, to excel and learn more in your career field, and also broaden your horizons and get experience. So, as I've said before in prior videos, this goes with for all branches of the military. The government does spend a lot, on training. They invest in military members. So any training that you get, you definitely want to take full advantage of it and make the most of these opportunities, as training does cost. It is expensive, and in many cases, the United States Armed Forces, either they pay the money to outsource these courses so that military members can receive the training, or they provide them themselves. But either way, there's always an underlying cost. So take advantage, of whatever experience you gain in any branch of service, but definitely the Coast Guard, as a commissioned officer. All this stuff is going to help you and going to help further your career. All right. Now, okay, the application process, okay, for anyone wanting to be a commissioned officer in this particular healthcare profession, you are designated to contact a Mr. Wade McConnell, and their email is wade.b.mcconnell@uscg.mil for the Coast Guard. If you desire to, apply as commissioned officer in this specific field as a healthcare professional. And obviously, your training for in this particular instance, okay, it's going to be at Cape May and the Coast Guard Academy. So you'll get your experience as a physical therapist, and they'll give you the specific and required training that you need, and you'll get definitely hands-on experience, and obviously with other individuals that are more experienced than you, so they can show you exactly how to treat patients and how things are done. For this one, this right here was actually really short, because they just give the contact information, of who to contact if you want to apply, to be a commissioned officer in this particular career field. But pretty much, you want to make sure that your records are stellar. Make sure that you have all debts, and bills, under control, and that includes anything, from bank loans to, student loan debt. The Coast Guard wants to make sure that they get the best individuals, not just in terms of their talent to do the job, but also in terms of their moral character. And your character attests for a lot, and it goes a long way, because you can train an individual to do something, but you can't teach good character. So again, I'll move on into another segment. If you desire to apply, to be a commissioned officer in physical therapy and rehabilitation, again, the contact information is a Mr. Wade McConnell, and their email is Wade, that's WADE .b.McConnell, MCCONNEL, and that's at USCG for US Coast Guard.mil. So you would contact this individual for the application process as a clinical and rehabilitation therapist. So now there are also other areas in the health profession program, such as a dental officer. Okay, and again, this right here is this is going to be real short and sweet, because they made this very easy and to the point. The contact is still the same, Mr. Wade McConnell, if you desire to apply as a commissioned officer, to become a dentist or to be a dentist in the United States Coast Guard. Okay, so let's go through this real quick. This is really going to be very short. Okay, as a dental officer in the United States Public Health Service, Commissioned Corps detailed to the Coast Guard, you can focus on clinical practice without the overhead and other burdens of maintaining a business. Basically, private practice. So you get a chance to get experience and also get to treat patients without having to have the overhead costs such as a private dentist would have. Okay? And obviously, they promise that every day will be challenging, and obviously each patient is different that you're going to treat. So, that would make sense, but in the Coast Guard, you get the experience, to learn about oral health, and also educate, military personnel on their dental health, and the importance of it, and also as a part of the National Team Committed Healthcare Professionals, you get to enjoy leadership opportunities, excellent benefits, and a work-life balance, while serving in the United States Coast Guard. So again, take advantage of these opportunities. For those of you that desire to be a commissioned officer in the Coast Guard and you want to serve in these health professions, this is what is offered. So take advantage of it. And if you desire to apply for this, the contact again is a Mr. Wade McConnell. Mr. Wade McConnell. Again, the email is wade.b.mcconnell@uscg.mil. That's for the United States Coast Guard. So, obviously, they made this one very simple, but I would have to make the assumption that, as with the other pathways to become a commissioned officer in the United States Coast Guard, a lot of the same things would apply in terms of financial responsibility, in terms of the limits, on how many dependents you can have. Also, setting up a dependent care plan, which you have to prove to the United States Coast Guard that your dependents, will be cared for, in your absence. In the event that you have to be away from your family or dependents because you're serving, on the Coast Guard or on a mission. So pretty much a lot of it definitely will be the same, but they just given a central point of contact in this particular case. So you contact this individual and he will help you get started and let you know exactly all the details and what you need to do in order to apply for this pathway as a commissioned officer. So what I want to do, I'm going to cut this video off right now, and then I'll come back with another to finish up with the other areas in the healthcare profession in the United States Coast Guard. But it's short, sweet, to the point, so they didn't lay out, all the details like I had to explain in the other videos for career fields or rates in the United States Coast Guard. So they just give you a central point of contact, which I have shared. But that's all I have for this video, and I'll come back with another video covering the other areas of commissioned officer pathways in the United States Coast Guard. So it's a little bit choppy, guys, but please forgive me. But the main thing is that the information is out there, and sometimes what's always effective isn't necessarily presented in the most spectacular or best fashion. But please forgive me, a little bit off on this one. But thank you to all my subscribers, and I will be back again with another video for the United States Coast Guard. So if the healthcare profession is given a central point of contact, then pretty much should be ready to close out this series of commissioned officer programs or pathways in the United States Coast Guard. Should be ready to close this out and come back with some more military content and other content as well, And thanks, guys, for listening. And the name of my YouTube channel is Eric Broadus YouTube. That's EricBroadus YouTube, or either ericbroadusyoutube.com. So please subscribe and smash that bell to be subscribed. Hit the like button to like the video. Hit the unlike button. Leave comments. Everybody has a right to be heard, and I'd love to dialogue with you. And if you desire any more information, or you might need a little bit of help in getting what you need, I'd be more than happy to try to throw my 2 cents in to point you in the right direction. And also I have a podcast called Snacks Thoughts. That's SNAKZTHOUGHTS, Snacks Thoughts. And you can find my podcast on Anchor, Spotify, Spreaker, Apple Podcasts, iTunes, SoundCloud, Radio PBM, and a host of other social media platforms. So that's all I have on this one. But I covered 2 rates or 2 career fields if you desire to serve as a commissioned officer. One as a clinical rehabilitation therapist, and then also as a dental officer. So that's all I have for this one, guys, and I will see you soon on the next one to hopefully close it out, on this series of officer commissioning programs in the United States Coast Guard. So have a good evening, guys. Peace out.